Welcome to this session. In today's session, we are going to look at Brainstem, and it is the first part of a 3-series video on the Brainstem. And today we look at Brainstem introduction. Then we look at the most rostral part of the Brainstem, the midbrain, and we look at some clinical correlations. Welcome all. My name is Wallace Munyere, and I'm the UREDactor. So, Brainstem. So the brainstem is the stalk-like part of the brain which usually connects the spinal cord with the forebrain. Okay, from below upwards, it consists of 3 parts. So the most caudal part of the midbrain is of the brainstem is the medulla or the medulla oblongata, then the pons, then the midbrain. The midbrain is the most rostral part of the brainstem or the most cranial part. So the midbrain is usually continuous above with the cerebral hemispheres, and the medulla oblongata is continuous below with the spinal cord. So brainstem is located in the posterior cranial fossa. Okay, its ventral surface or its anterior surface usually lie on clevers. Posteriorly, the pons and the medulla are separated from the cerebellum by the cavity of the fourth ventricle. Okay, so I don't know if I have a diagram for that, or first look at the functions of the brainstem. The brainstem, in fact, if we say you are brain dead, we mean that your brainstem is not functioning. Brain dead. Brainstem, I think, has vital centers. It has respiration center, the vasomotor center. So important centers are located here. So the midbrain is very, very important. Okay, so you can have an injury to the other parts of the brain, say the forebrain, it will affect you, but an injury to the brainstem, that is bad. That is really, really bad. Let's look at 4 major functions. It usually provides passage to various ascending and descending tracts that connect spinal cord to the different parts of the forebrain. It also contains important autonomic reflex centers, such the vital centers, which are usually associated with control of respiration, heart rate, and blood pressure. It also contains the reticular activating system. The reticular activating system is the one which is responsible for controlling the level of consciousness in the body. It also contains important nuclei of the last 10 cranial nerves. So the 3rd to the 12th cranial nerves, their nuclei are contained in the brainstem, but the nuclei for the first and the second, only the first and the second cranial nerves, that is the optic nerve and the olfactory nerve, which don't originate from the brainstem. So you can see how important the brainstem is. Okay, now here's the brainstem, the ventral surface. Here is the midbrain here. Then this is the pons. Then this is the medulla. Okay, so those parts. Then let's look at the dorsal surface. This is the dorsal surface of the midbrain. It has 4 elevations known as the corpora quadrigemina. Then here is the posterior surface of the pons. Here is where the 4th ventricle is located, and this is in the medulla. Here the cerebellum has been cut, and you can see this. This is the middle cerebellar peduncle, which connects the cerebellum to the pons. Okay. Now, midbrain. Midbrain is the upper and the shortest part of the brainstem. It is 2.5 centimeters long and 2.5 centimeters wide. It usually connects the hindbrain with the forebrain. Okay. Its cavity, the cavity of the midbrain is known as the cerebral aqueduct of Sylvius. It usually connects the 3rd ventricle. The 3rd ventricle is found in it is the cavity of the diencephalon with the 4th ventricle. So the midbrain passes through the tentorial notch. It is situated on either side. Either side it is related to the optic tract, the parahippocampal gyrus, and the posterior cerebral artery, and the basal vein And anteriorly, it is related to the interpuduncular structures that are found in the interpuduncular fossa, which include the mammillary bodies, tuber cinereum. You'd also find the infundibulum, and the posteriorly, it is related with the splenium of corpus callosum, the great cerebral vein of Garen, the pineal body, and the posterior ends of the right and the left thalami. Or you find some text calling these posterior ends of the right and the left thalami the pulvina of the thalamus. Okay, now here you can see anterior relation. This is the midbrain here. You can see it is related to these structures located in the interpuduncular fossa. These are the mammillary bodies, the tuber cinereum, infundibulum here. Okay, or the infundibulum is also known as the pituitary stalk. So let's look at the ventral surface. Now this is the midbrain here. This is the midbrain. You can see the ventral usually presents two crura cerebri. This is a crus cerebri. Two of them are the crura cerebri, or the cerebral crus, or crura cerebri, which merges with the superiorly or rostrally. These crus cerebri merge with the cerebral hemispheres. Then they converge downwards like this to be continuous with the basis pontis. Okay, so they usually form, these crus cerebri form the posterolateral border of the interpuduncular fossa. Okay, the interpuduncular fossa, they form the posterolateral boundary. So that interpuduncular fossa, if I can draw it here, its boundaries, this is its anterior boundary. The optic chiasma is its anterior boundary. Then the anterolateral boundary is the optic tract. Then the posterolateral boundary is the crus cerebri. Posterior boundary is the pons, like that. So the interpuduncular fossa is that area bounded by those. You can see the contents. You have the tuber cinereum, the mammillary bodies. We also have the third cranial nerve, the oculomotor nerve. We also have the infundibulum here, or the pituitary stalk, and the posterior perforated substance. Okay, so those are the contents of the interpuduncular fossa. That please know those boundaries. The superficial surface of the crus cerebri is finely corrugated by the underlying longitudinal fibers. If you look at this crus cerebri, you can see it looks like the corrugated iron sheets. That is because of the underlying longitudinal fibers, the projection fibers, namely the corticospinal and the corticobulbar fiber tracts. It is crossed transversely from above downwards by the optic tract. So these crus cerebri are usually closed by the optic tract as the most superior. Then we have the posterior cerebral artery, which I've not indicated here. Then also the superior cerebellar artery, then the tinea pontis. Then between superior cerebellar artery and the posterior cerebral artery, and remember posterior cerebral artery is superior to superior cerebellar artery, you will have the fourth cranial nerve, the trochlear nerve, and also the oculomotor nerve will lie between those two arteries. So these two nerves lie between posterior cerebral artery and the superior cerebellar artery. Now, the oculomotor nerve emerges from a groove on the medial side of crus cerebri, and the trochlear nerve emerges on the dorsal aspect of the midbrain, then curls around the lateral aspect of cerebral peduncle to appear on the ventral aspect of the midbrain, lying lateral to oculomotor nerve. As I had said earlier, these two nerves run forward between posterior cerebral and superior cerebellar arteries. Okay, so one unique thing about trochlear nerve is that it is the only cranial nerve that emerges from the dorsal aspect of the brainstem. All the others emerge from the ventral surface. But after emerging from the dorsal, it usually curl towards the ventral surface, and it will, as it curls, it will lie on the crus cerebri. So let's look at the dorsal surface. Now, the dorsal surface of the midbrain presents four rounded elevations. As you can see, these two inferior and these two superior. Okay, those are the rounded elevations, and they are known as the corpora quadrigemina or the colliculi. We have these two superior colliculi and these two inferior colliculi. Okay, now they are separated from each other by the cruciform sulcus. Why the name cruciform? It looks like a close. You can see here there is this sulcus. It looks like that. Like that. The cruciform sulcus. Okay. So, the cruciform sulcus. The vertical limb of the cruciform sulcus. The vertical limb of the sulcus, when placed above, forms a surface depression which rouges the pineal body. You can see when this vertical limb of the sulcus, this is the pineal gland here. And when placed below, it is continuous with the frenulum veli. Frenulum veli is a median ridge on the dorsal surface of the superior medullary verum. This is the superior medullary verum. Then at the midline of the superior medullary verum, you have this like a valley. So it is known as the frenulum veli. Now the trochlear nerve usually emerges from this posterior aspect here. Then it curls to the ventral surface after decussating. Now, thick ridges of white matter extending from the lateral side of each collicula constitute their brachia. You can see these inferior colliculus usually communicate with the medial geniculate body via this. You can see here. This is known as the inferior brachium, and the superior colliculus usually communicate with the lateral geniculate body of the thalamus via the superior brachium. Okay. The superior brachium usually connects the superior colliculus to the lateral geniculate body and the optic tract, and is made up of optic tract fibers, where the inferior brachium connects the inferior colliculus to the medial geniculate body and is made up of auditory fibers. Now, the superior and inferior colliculi are concerned with reflex activities triggered by auditory and visual impulses respectively. So I think here there is a mistake. The superior colliculi is the one which is concerned with the visual reflexes, where inferior colliculi is concerned with auditory reflexes. Okay, sorry for that, but let's continue. Now let's look at the internal structure. Now this is the diagram, and by the way, you can be asked to draw this diagram even in an examination. So I urge you, please understand this diagram. Now the midbrain has two parts, two broad parts: tectum, which is the part which is behind the cerebral aqueduct of Sylvius, and then cerebropeduncle, which is the part ventral to the cerebral aqueduct of Sylvius. And the cerebropeduncle has three parts: tegmentum, substantia nigra, and the crus cerebri. Okay. Now the structure of crus cerebri and substantia nigra does not change across the midbrain. Okay, but that of tegmentum and tectum might vary. Okay. Now let's look at the crus cerebri, or the other name of crus cerebri is basis pendiculi. Now, the crus cerebri is the part of the cerebropeduncle situated anterolateral to substantia nigra. It contains important descending tracts which connect cerebral cortex to the anterior horn cells of the spinal cord, the cranial nerve nuclei, and the pontine nuclei. Okay. Those projection fibers include the corticospinal and the corticonuclear, which is the pyramidal tract, occupy the middle 2/3 of the crus. Then the frontopontine fibers occupy the middle medial 1/6 of the crus, and the temporopontine, parietopontine, and occipitopontine fibers occupy the lateral 1/6 of the crus. So this is the crus cerebri. You can see it is lying anterolateral to the substantia nigra. So in the medial 1/6 frontopontine fibers. In the middle, 2/3, we have the corticospinal and the corticobulbar fibers. Then in the lateral 1/6, we have the temporopontine, occipitopontine, and parietopontine fibers. Okay. Then let's look at substantia nigra. Substantia nigra is curved, or you can see it is crescent shaped, and it is a pigmented band of gray matter, which is thicker medially than laterally. You can see it is thicker medially than laterally, situated between tegmentum and the crus cerebri. It is divided into 2 parts. So substantia nigra has 2 parts: the pars compacta, which is the dorsal part, and the pars reticularis, which is the ventral part. Now, the pars reticularis is intermingled with the fibers of crus cerebri. Now, substantia nigra is made up of deeply pigmented nerve cells which contain melanin. Now, melanin is a polymerized form of dopamine. Okay, so dopamine, when polymerized, forms melanin. Melanin is the one which now makes your skin, okay, which makes skin to be dark. That is why even when you look at a cross section of a midbrain, you will see substantia nigra is somewhat dark due to melanin. But melanin is the polymerized form of dopamine. These cells are dopaminergic in nature. They produce dopamine. And also they contain iron. These cells usually synthesize dopamine, which is carried through their axon. Now the axons from these cells, they transport that dopamine to the corpus striatum. So those fibers are known as the nigrostriatal fibers. Also, these cells, some of the axons of these cells connect the substantia nigra to the red nucleus. Okay, so efferents from substantia nigra include the corpus striatum and red nucleus. Please remember that. Now let's look at a transverse section of the midbrain at the level of inferior colliculi. What will you see when you take a transverse section of the midbrain at the level of inferior colliculi? The structure of crus cerebri and substantia nigra won't change, but that of tegmentum and tectum might change. Now let's start with that of tectum. The tectum, you'll see the nucleus of inferior colliculus, okay? And you will see the lateral lemniscus terminating into the inferior colliculus. Please note the lateral lemniscus terminates into the inferior colliculus. Then here you can see the spinal lemniscus, then the trigeminal lemniscus, then the medial lemniscus, okay? And what will help you to know you are at the level of inferior colliculus? The decussation of superior cerebellar peduncle. This is what will help you most, okay? Also, you can use the trochlear nerve, okay? You can see here the trochlear nucleus, then it decussates, then emerges from the dorsal surface of the midbrain, then it will wind and come to the ventral surface of the midbrain. Here you can see the cerebral aqueduct of Sylvius, then here you can see the periaqueduct of Gray. Okay, then here you can see the mesencephalic nucleus of trigeminal nerve. The mesencephalic nucleus of trigeminal nerve receives proprioceptive impulses from the muscles of mastication, ocular and facial muscles, and also from the teeth. Okay, then here you can see the medial longitudinal fasciculus. This is the tectospinal tract. This is the rubrospinal tract. Okay, please know the arrangement of these structures, how they are arranged. Okay, you can be asked to name, please. Then let's look at the level of superior colliculus. Here you can see that the lateral lemniscus is absent. Why? Because it terminated in the inferior colliculus. So here you can see superior colliculus, then the spinal lemniscus. Spinal lemniscus is the upward continuation of the spinothalamic tract. Then you can see the trigeminal lemniscus, then the medial lemniscus, then the red nucleus. The red nucleus is what will help you to identify you are at the level of superior colliculus. Then you can see here two decussations. Here we have the dorsal tegmental decussation of Maynard, and this is the ventral tegmental decussation of Forer. Now the dorsal tegmental decussation of Maynard is the decussation of the tectospinal tract, where the ventral tegmental decussation of Forer is the decussation of rubrospinal tract. Okay, then here you can see the oculomotor nucleus. Then here you can see where the medial longitudinal fasciculus is. It is lined just lateral to the oculomotor nucleus. Then here you can also see the mesencephalic nucleus of trigeminal nerve. Then here you can see the pretectal nucleus. Pretectal nucleus is very important, especially because it is involved in pupillary light reflex. Okay, we will look at that when we look at the optic pathway, the pathway of light. Okay. So, but at all levels of the midbrain, the reticular formation is there, and the reticular formation maintains the level of consciousness in the body. Now, let's look at function. So, superior colliculi, reflex center for visual reflexes, inferior colliculi, lower auditory center, probably concerned with the reflexes involved with auditory stimuli, red nucleus, involuntary control of muscle tone and posture, substantia nigra, regulate the activity of basal nuclei or the basal ganglia, nerve of oculomotor and trochlear nerve. They give motor fibers to these nerves which are concerned with activities of both intrinsic and extrinsic muscles of the eyeball. The cerebral pentacles containing number of ascending and descending tracts which provide passage for the fibers of motor and sensory tracts. So this is now a read section. Here you can see the dark pigmented. This is a substantia nigra. These are your crus cerebri. These are the red nucleus. This is the cerebral aqueduct of Sylvius. When you see the red nucleus, you automatically know we are at the level of superior colliculus. Sorry. Then here you can see the inferior colliculus. Okay. Here then you can see the medial longitudinal fasciculus. Okay, or this is the dorsal tegmental decussation. It is the decussation of the tectospinal tract. Now, clinical correlations. These are very important. We have Weber's syndrome. It is usually produced by vascular lesion in the basal region of the cerebral pentacle due to occlusion of a branch of the posterior cerebral artery. This lesion involves the oculomotor nerve and the crus cerebri and produce the following important sign. There will be an ipsilateral lateral squint. Why? Due to involvement of oculomotor nerve. There will be contralateral hemiplegia. Why? Due to involvement of the corticospinal tract in the crus cerebri. There will be contralateral paralysis of the lower part of the face and the tongue. Only the lower part of the face and the tongue due to involvement of the corticonuclear tract. When we look at the corticobulbar tract, you will see why the upper region of the face will not have paralysis. There will also be drooping of the upper eyelid, or what is known as ptosis, due to paralysis of the levator palpebrae superioris muscle, which is supplied by the oculomotor nerve. The pupils will be dilated and fixed to right, and accommodation is usually lost on either side due to lesion of the Edinger-Westphal nucleus. Edinger-Westphal nucleus is the parasympathetic component of oculomotor nerve. Now, then we have another one which is known as BENEDICKTS syndrome. It occurs due to vascular ischemia of the tegmentum of midbrain involving the medial lemniscus, spinal lemniscus, red nucleus, superior cerebellar peduncle, and fibers of oculomotor nerve. It is characterized by the following signs and symptoms. There will be ipsilateral lateral squint and ptosis due to involvement of oculomotor nerve. There will be contralateral loss of pain and temperature due to involvement of the trigeminal. Trigeminal is for the face, and the spinal lemniscus for the rest of the body. Contralateral loss of tactile muscle, joint, and vibration sense due to involvement of the medial lemniscus, which is the upward continuation of the dorsal column tract. Dorsal column refers to your fasciculus gracilis and your fasciculus gluteus. Then there will be contralateral tremors and involuntary movements of the limb due to involvement of the red nucleus. The red nucleus, remember, it controls the posture and the tone of the muscles. So if it is damaged, there will be tremors and fibers of the superior cerebellar peduncle entering into it. Now, then we have Parinaud syndrome, which results from a lesion of the superior colliculi as it occurs when this area becomes compressed by tumors of the pineal gland. It is usually characterized by loss of upward gaze without affecting other eye movement. The anatomical basis of this is obscure, but experiments indicate that the area that may contain a center for upward eye movements is located near the superior colliculi. Then we have the Argyll-Robertson pupil, which is a clinical condition in which right reflex is lost, but the accommodation reflex remains intact. Generally, it occurs due to lesion in the vicinity of the pretectal nucleus. So when the pretectal nucleus is damaged, you will have an Argyll-Robertson pupil. Okay, so the right reflex will be lost, but the accommodation reflex remains intact. So this is the area involved in Parinaud syndrome. This one is involved in the BENEDICKTS syndrome, and this is the one which is involved in the Weber's syndrome. So I hope you have understood, and thank you for your attention. And please subscribe for more anatomy and biochemistry content. Thank you.